I was going to ask you that, how you plan to go and deal with this surge that is coming from a healthcare resource standpoint. You laid out a few things. Are there more situations as it relates to potentially running out of hospital beds and all of that? You did mention some of that.
Well, Ohio's a complex state. You know, it's not like we have one big city. We've got a number of very significant cities. We're almost a state of city-states, and so we got a lot of different regions. So one of the challenges for us as we work with our local hospitals is kind of do it regionally and making sure that somebody, no matter where they are in Ohio, whether in the city or the most rural area, you know, if they get sick, that the care is there for them, and then if they have to be transferred to a major hospital, we need to make sure that that's possible as well. So we're really focusing a lot on that. So you're really doing two things at once. You're trying to keep the social distancing to prolong this, push it out further away so that we have time to actually do the build out and do all the work that we needs to be done to get ready for the surge that's coming.
Governor, I know you have that stay-at-home order that in place, at least I think through April 6th, if I'm not mistaken. I am wondering about what you do specifically for those, and you've obviously had to deal with this in Ohio, those businesses and residents who are not obeying by that stay-at-home order that you have sent. What's the repercussion, and how do you combat people that are not playing along?
Well, we have 113 health departments in the state, and they're the ones who are at the front line. You know, we've had health departments who have gone out and closed places. And so we've asked them, really, the businesses to do two things. One, only the essential businesses. If you are allowed to stay open, we also, though, have a very specific list of health things that you need to do. You need to keep the distance. If you can't keep the distance, you can't be open. I mean, we've got to do this to slow this thing down. So the health departments have a checklist. If they go out, they can go through that very quickly. We simply want businesses to comply. We're not, you know, necessarily, if it's an essential business, we want them to be able to continue, but we also need them to comply with the health orders.